I received a lot of requests to talk about back pain and neck pain. So let's talk about it, and I would like to share with you kind of my philosophy, what my conclusions are on a back pain and neck pain, what causes them, and how we need to address them. We're not talking about severe neck pain and back pain, again, related to significant structural changes like tumors in a neck or back, or big disc herniations that may need to be treated either surgically or have some kind of large injection done. We're talking about a chronic neck and back pain that comes and goes, that exacerbates by activity, by lack of activity, by our sleep, by what we do on a daily basis. So let's kind of talk about the general principles first, and then we'll talk about separately lower back and upper back pain. Before we'll go there, we really need to address that in our body, the whole spine works as a single unit. We don't move our neck separately from our lower back. Everything is really connected. And everything, all the muscles in reality in our body are connected by fascia. That's a connective tissue layer that starts at our heels and goes up to the top of our head. And that's a single layer without any interruptions. So in reality, when you have your knee injured and you are not moving your knee correctly, you potentially may develop neck pain or even jaw pain because of that knee injury. And of course you will go to a physician who addresses your neck pain or jaw pain, and they will not be able to figure out to solve your problem. So in reality, we really need to start looking at the whole body as the whole unit to make sure that all the joints are working correctly, pelvis is moving correctly, your neck moving correctly, and your shoulders moving correctly, and then we'll be able to address the underlying problem. So vast majority of women who come to my clinic with migraines have very limited range of motion in their shoulders. And how do I know that? Well, if you will look between your shoulder blades, there is a muscle that connects your shoulder blade to your spine. It's called rhomboid muscle. And very, very commonly, women will have a considerable spasm in that muscle, and you can see like a muscle knot in that area. What that means is that the shoulder blades do not move correctly and not participating in the shoulder movement. That's why this muscle is spasms. It's trying to kind of move the shoulder blade, but it cannot do that. And that's related to, again, limited range of motion in the shoulder blade. So when we move our shoulder, instead of using very large muscles in our back, we're starting to use our neck muscles that are pretty thin, and they are really not designed to help us with a shoulder movement for a very long time. So of course those muscles will get very tired, our neck will get very sore, and that eventually potentially will lead to headaches as well. So in order for us to get rid of that part of the equation, we really need to start moving on working on our shoulder blade motion and our shoulders. When our shoulder blades are not moving right, and our rhomboid muscles on the back again getting weaker, our shoulders roll forward, and we'll have very tight muscles here. It's called pectoralis muscles. Okay, so in a normal posture, when the head sits exactly where it's supposed to be, on top of the shoulders, straight up, the load on the neck is about 3 pounds. When our shoulders move forward, our neck will also move forward. It's just a physiology how the spine works. And then the load on our neck will become about 10 pounds. And then when we look at our phone for a very long time, that load is about 60 pounds. So your muscles, when we look at the phone for a very, very long time, are having load nearly 20 times more than they're supposed to. They can certainly handle that for short duration of the time, but if we're constantly in this position, scrolling through Facebook or scrolling through whatever social media of the day is, you will have considerable neck pain and neck tightness. Even when we're sitting in front of our computers with our shoulders moving up, because that's kind of much more comfortable for us to type, your neck will go forward, and eventually we will have neck pain and we'll have headaches. So again, we need to start working on the shoulders, on how they sit on our sit in our body, and how all the muscles are not pulling them forward and they're getting relaxed. That goes to posture, general posture of the patient. So if the posture is poor, very commonly patients will have headaches just because of that. Sometimes our pelvis is tilted in a wrong way, or tilted over tilted, and then reflexively our neck again will tilt forward and shoulders will go forward. So neck pain may not necessarily be related to the pain in the neck per se, but dysfunction in a pelvis. Okay, so we always have to look at the whole thing. But postural therapy is absolutely paramount for patients who want to get rid of neck pain and back pain in the long term. Because unless we will realign the spine again correctly, the pain will be coming back. Also, everybody thinks that neck pain and back pain are related to bad bones. So all the spurs and all the discs that are in the bones, but bones themselves don't move. What moves them are the muscles. Okay? And sometimes one of the muscle, for whatever reason, will get weaker, and then the muscle that is opposing to that, it's called agonist or antagonist, will move the muscle, will pull the bone to the side because it's stronger. It just kind of have a pull-push mechanism. And then the bone will say, well, I'm not supposed to move that way. Let me just reinforce myself. Let me create more spurs, and this way I will not move as much. Well, initially that's a good compensation, but as the time progresses, the more we pull at that bone, the more spurring we develop, and then eventually that spurring will start pushing on the nerves and will start causing nerve pain, and potentially some of the discs will start herniating, and that also will create the pressure on the nerves. So we need to start thinking that bone is not the problem. The muscles that are pulling that bone are the problem. So we need to readdress that. And a lot of people will go to physical therapy, and there is really nothing wrong with that, except that if you have a weaker muscle and a stronger muscle, well, the strongest will be working really hard and the weaker muscle will not be working really hard. So in reality, if you're working on just physical therapy, you'll be reinforcing your bad patterns. You'll be working on the stronger muscles, and the weaker muscles will not be working as hard because they're not active. So there is a technique called muscle activation technique that actually will determine which muscle is weak or underperforming and which muscle is strong. And they have technology how to really reactivate those muscles and allow our body to actually use all the muscles that were supposed to be used for that particular direction of the movement. So all of this is something that we really don't think about. We all go to chiropractors, we all go to massage therapists, we all go to physical therapists, but very commonly it will get you better right away or with some time, but it's not going to get you better long term. And the postural therapy and muscle activation that's what we're really missing for us to get a long-term improvement. This video is by no means is a bashing on massages and physical therapy or chiropractor. They're all extremely useful, but I think there should be an order of operations. We need to get the muscles activated and balanced, and then we will be actually the chiropractic manipulations will be more beneficial, massage therapies will be more beneficial. Just think about this, for example, massage therapists. They will relax your muscles, but then you start going about your life and you start using the same movement patterns that you had before, and the muscles will become tight again. So you'll need to go to massage therapy again. And it will be a vicious cycle until you will figure out, or may not ever figure out, that some of the muscles are actually not working properly and they're pulling the bones. a lot of physicians focus on bony changes. So as a neurologist, we all do MRIs. We look at the spondylosis, well, and say, well, you see, you have a lot of spondylosis, that's what causes your back pain. Well, there are studies that actually looked at it and determined that about 85% of patients who have no back pain or no neck pain have those changes as well. So those changes are not necessarily the cause of the back pain or neck pain. They may be just a correlate with the back pain and neck pain, but in reality, all our pain is coming from our muscles. In my mind, when patients come to me with complaints on neck pain, back pain, or very commonly migraines, I always look at their posture and always try to address that first. Postural therapy is not actually very strenuous therapy, and anybody can do that at home if you have the right exercises and if postural therapist actually looked at you and told you what needs to be done, what exercise needs to be done. And sometimes those exercises will need to change with time, because as our body realigns itself, then we'll have more disbalances or more kind of postural abnormalities popping up just because they've been sitting there for a while. So this is the approach that I have to neck pain and back pain. It's a little bit different. Obviously, we're not talking about medications. There are medications that will help with the pain, but they're not going to really do anything about disbalances in the muscles. So this is a patch. So we're not even talking about that. Supplements, they most likely not going to help you. So in reality, what you need to focus on is think about your posture, how your muscles are being activated, and then we can start getting the massages and chiropractic manipulations and physical therapy. We certainly can do them earlier, but they may not be as effective long term. But after we aligned our posture, then all the other therapies potentially will be much more helpful and longer lasting. The last thing that is very important for us to think about is the gait pattern. How do we walk? How do we move? And we will cover that in the next video to not make this video very, very long. If you're interested in this kind of approach, if it jives with you, please like this video, please contact me via my website, and I'll be happy to talk to you more about much more details how we can address neck pain and back pain through this kind of approach instead of just giving medications and covering symptoms.